Here we'll take a look at hydrocephalus. What can you expect? Increased intracranial pressure. What are all the different ways in which we can develop hydrocephalus? Well, interesting enough. Be careful with this one. Each one of these bullet points that I'm going to give you here are incredibly important clinically. So what does hydrocephalus mean to you? It means that within the, let's say, subarachnoid space, or so it appears, that the subarachnoid space is accumulating fluid. Hydro. Huh? But what if you're not? What do you mean? Well, what if the ventricles look like they're dilated? What ventricles? I want you to focus on the lateral ventricles. Are you there? Lateral ventricles. Okay, good. I want you to go and think of a transverse section of your lateral ventricles and looks as though that it's enlarged. So maybe it's fluid accumulating in there, cerebrospinal fluid resulting in hydrocephalus, but there's absolutely no indication of increased intracranial pressure. But your patient is 7 years of age, forgets everyone's name, even walks out the door naked, and never comes back. Obviously referring to Alzheimer's disease. And what do you know about Alzheimer's and the size of the brain? So now the cerebral cortex is undergoing atrophy. The more that the brain parenchyma, are you picturing this for me, please? Close your eyes and picture this. As the brain and its parenchyma is undergoing atrophy, let it be Alzheimer's, or maybe there is frontotemporal dementia, formerly known as Pick disease. And then the ventricles look as though that they're enlarged. It looks as though that there is going to be cerebrospinal fluid. So just keep that in mind as being an important differential when you're dealing with hydrocephalus, and that is specifically called ex vacuo that I'm referring to. But in general, when you're dealing with hydrocephalus, dilation of the ventricles, perhaps due to cerebrospinal fluid. But then the next question is, how did the cerebrospinal fluid accumulate within the ventricles, is your question. Because this will then give you the clinical description of what type of hydrocephalus. Is it communicating? Is it non-communicating? Okay? If you've been confused with that, trust me, by the time we're done with this section right here, you'll be golden. First, let's begin with communicating. So what does communicating mean to you? I want you to picture for me, once again, transverse section, or maybe a sagittal section, in which you're noticing the lateral ventricles, you're moving into the third and then fourth ventricle, and then what do you come out of? Who comes out of? The cerebrospinal fluid. It comes out of the luschka, and it comes out of the meningi, don't they? The apertures. And as long as that is open between the lateral third and fourth ventricles, out through the aperture, bathing the spinal cord, then it's all communicating. Then how in the world can you have an increase in intracranial pressure? How can you accumulate cerebrospinal fluid if there's perfect communication with all the ventricles, Dr. Raj? Well, where does cerebrospinal fluid get drained? Where does it get drained? Good. Arachnoid villi, the arachnoid granulation. So after you bathe your spinal cord, you make your way up into the sinuses, and then you're going to drain into arachnoid granulation. So what if there was meningitis? And post-meningitis, or for whatever reason, let's say there was fibrosis, and there's scarring taking place of that arachnoid villi and granulation. If that occurs, you can no longer drain. What are you going to result in? Increased cerebrospinal fluid in the subarachnoid space, but the communication existed, didn't it? The problem was up in the arachnoid granulation. So you call this a communicating type of hydrocephalus. It's non-obstructive. Every word that comes out of your mouth in medicine must be accurate, dead on. Otherwise, if you start memorizing, you're going to trip over your words, and you don't want to do that. The blockages CSF exit either at arachnoid granulation or maybe the foramen of magenta or luschka may result in a communicating type of hydrocephalus. Something that you want to keep in mind with the luschka and magenta is tuberculous meningitis. Do you remember that? With tuberculous meningitis, quickly tell me about the lumbar puncture. On cerebrospinal finding, what kind of WBC? Predominant lymphocytes. What about your glucose level? They would be low, and the protein would be high. Tuberculous meningitis is usually found by the basal region. There's every possibility that it might then block off the magenta and luschka. And if that's the case, may result in hydrocephalus, most likely the communicating type. Non-communicating. What may happen here? The non-communicating has a listed differentials that are long. For example, what's the most common brain tumor in a child? Medulloblastoma. Medulloblastoma may be affecting your cerebellum, occiput, and therefore compressing upon the fourth ventricle. What's the most common type of astrocytoma in a child? What if you find a cystic type of image on the cerebellum? The most common type of astrocytoma in a child will be pilocytic. This may then cause compression upon the fourth ventricle. You with me? What's the name of the condition in which your posterior fossa might become too small? Think about the posterior fossa. What if it's too small? What's it going to do? I'm pushing my occiput forward. What am I going to do? I'm going to then compress my fourth ventricle. That's called Arnold-Chiari. You see as to how the list is a little bit longer here with non-communicating, right? Or for that matter, any space-occupying lesion that is then causing blockage of cerebrospinal fluid from passing through your lateral third or fourth ventricle is called non-communicating obstructive type of hydrocephalus. Compression of third or lateral ventricle by mass or mass effect from edema. Anything, any type of mass, which is then causing lack of communication, is obstructive. Now, obviously here, if you don't treat this at some point in time, we will discuss our different types of herniations. Maybe it's subfalcine. Maybe it's your transtentorial or uncal herniation. So obviously, the brain parenchyma is then going to herniate in whatever region if left untreated.